My name is John Nosta, and I'm a digital health innovationist. My background is actually in cardiovascular physiology. I studied that early on in my career, and for the past 20 years I've focused on developing interesting, compelling, and provocative communication to a variety of healthcare stakeholders, from the academic KOL to the physician, to the patient, and through the caregiver. In the simplest of terms, Nosta Lab is a digital health think tank that looks to empower innovation through communication. So what are the game changers? I think the interesting thing is that we don't know the game changers, because it's the nature of technology, and these changes are occurring so rapidly that their actual implementation will surprise us. But let's talk about some fundamental things that are happening today. Number one, genomic analysis. The ability to analyze your genomic makeup is going to be very, very big for two important reasons. It's cheap. It's now coming down to $1,000, even less, to be able to look at your entire genomic profile and see what you're inclined to have, what sort of genetic predispositions you might have to diabetes, to sensitivity to drugs. But the other side of the equation is it's becoming faster. So now, within 6 hours, you could have, in certain instances, a genomic analysis. So what does that mean? Well, if you're a patient admitted to the hospital, you can have a complete genomic analysis available to your physicians the very next day or in the morning. Now, nanotechnology is a really cool thing. Everything is getting smaller. And what we're seeing are nanosensors that can monitor various chemicals or clinical parameters in your body. Soon, we'll be able to monitor certain chemicals in your body that will tell you that you're having a heart attack. So what we're doing is changing from this acute, oh my God, run to the hospital dynamic, to you're having a heart attack, make an appointment with your doctor in a couple days because this event could happen in 2 weeks. It changes acute to chronic. The third one that's really interesting is this idea of wearables. We talk about wearing a Fitbit or a Nike Fuel or some of these devices that track your heart rate and activity. Wearables are going to become dermals. In other words, you're not going to wear it anymore. It's going to become like a temporary tattoo or a Band-Aid that you put on your skin. The dermals are going to move to things like something where you can actually ingest, and that can track various physiologic activities. One of the most classic examples is a pill you swallow that does a colonoscopy. So it's much less of an invasive procedure. That's going to change things quite dramatically. In the era of digital health, not only do we have a very technological sophistication, but we have the empowerment of the patient, the democratization of health. And it's absolutely essential that patients can understand innovation, can apply it to their lives, and realize that digital health is not some abstract technological concept, but a check engine light for your body.